The body is designed in such a way that every muscle must start at a specific position and end at a specific place.
Dance was a huge passion.
When you consistently keep dancing while using the wrong muscles, the knee joint eventually becomes extremely painful. Generally speaking, when those thigh muscles work incorrectly like this, it places excessive, unnecessary pressure on the joint and significantly increases the rate of bone wear and tear over time. So, welcome to Marian Ayurveda. In this episode, we are discussing the knee pain commonly seen in many people, especially children who dance or are active in sports, as well as mothers and women, or the chronic back pain they often experience and why it happens. I am Dr. Anumod Kakkassery from Marian Ayurveda, located in Thrissur. Today I have Sindhya with me. So, Sindhya, what were the difficulties you were facing when you first came here?
I was in a situation where I couldn't do my daily activities normally. I was a working woman, but even when I went to the office, like sitting for a long time caused pain. Also, I couldn't do daily activities at home like cooking the way a normal housewife does. I couldn't stand for long periods and I had severe back pain. I would even wake up from sleep due to back pain when lying down.
I wake up sleeping.
I would wake up when changing positions. I would be aware of it, and then I would go back into a deep sleep. But changing positions has become an incredibly painful experience for me lately. Also, I constantly feel like I simply cannot support my own body weight anymore. I always feel like my back is extremely heavy, as if it's under immense pressure. Right now, I'm always hunched over because of this. I find that I can't stand up straight or stiffly at all. It honestly feels like I'm carrying something heavy on my shoulders every single moment of the day. So because of all this, I'm just always feeling quite unwell and drained like that.
Were you able to stand straight until the end?
I could stand straight, but there was a hunched position that I found comfortable. I couldn't stand straight, so
Finally, here, the issue with standing straight.
all those issues are gone.
You were a sports person. What kind of sports?
I was more into arts than sports. Dance was a huge passion of mine, a really huge passion. I used to go for dance, but then I fell and had a minor back injury, and after that, I didn't pursue it anymore.
Dance? What kind of dance did you do?
I used to do everything.
Really? Still?
Folk dance.
Folk, that's something that requires a lot of jumping around.
Folk was the main one, and then I used to do semi-classical and things like that.
It was dance, but did you play any sports?
Relay, yeah, I was always involved in the relay races back then. And then, we also used to do shot put and all sorts of other track and field events when we were at the school level.
Did you make state?
No, I didn't do that in ICSE.
That's true. Folk dance is something that causes so much muscle damage, right?
Yes, that dance.
Dancers generally have muscle complaints. If they are dancing, they often use the wrong muscles repeatedly, which makes their knees extremely painful. It's difficult to fix muscles for dancers. It takes a lot of time. It's not like a normal person walking, right? They use those incorrect muscles. And then there are those special movements for the legs, aren't there?
So I have the main shin bone, right? When I jump and take steps, there is severe pain in my shin bone. I mean, it was severe pain, but I used to dance through it.
Now,
It's not just a little bit for me. My face only brightened up yesterday morning. I was extremely worried about the other thing because this is a pain I've had for many years. So whenever I get out of bed, my tension is, oh no, is it going to hurt again? That's the tension I have. But today I am extremely happy. Before, I wouldn't even let the therapist touch me because wherever they touched, even just a light touch, it would hurt. Now, even when my friends come and touch me like this, when they touch me, it's extremely painful. So when I scream, they call me a drama queen, saying, we barely touched you. But honestly, it's so painful that tears come to my eyes. I don't even know if it's inflammation or what it is.
it might be because the muscle is working incorrectly. It's a natural mechanism of the body to cause swelling to prevent further damage. So the swelling itself isn't the real problem. When a muscle works incorrectly, continuing to use that muscle will only increase the damage. Therefore, swelling is a defensive mechanism of the body. As our muscle gets better, the swelling will no longer have a role and will disappear. And regarding disc issues, discs are definitely something that can heal easily.
But more than the disc, I had muscular.
It was muscular pain that I had the most.
Wherever the therapist touched, I would scream.
So when we look at this person, their muscles, especially the thigh muscles, all of them, we know that every muscle is designed to start at a certain position and end at a specific place. That's how the body is organized from insertion to origin. So when we looked, all of these alignments were very wrong. We know that if the alignment of a car's tires is off, the problem is that the tire gets damaged quickly and wears out, right? It's the same with the thigh muscles. When they work incorrectly, it puts pressure on the joints, and similarly, it significantly increases wear and tear on the bone above the knee in the knee's alignment. And if these muscles don't work properly, whether it's blinking, opening your eyes, moving your hands, or climbing up and down stairs, it's the muscles that help us with everything. If there's any issue with the muscles, not a single movement would be possible. Now, one thing we understood about this person was that they were unable to stand upright. Even though we tried many things, we finally discovered that a muscle called the external oblique, which runs from the middle of the waist to the abdomen, was misaligned. It was because its function wasn't correct that they couldn't stand straight. Once we corrected the function of that muscle, it only took about 10 minutes. But the main thing was to identify that. So as soon as we corrected that muscle, they were able to stand upright. Often, when many patients come, they tell us that they have come with a disc bulge. But they say they are unable to bend. There is severe pain when bending. Standing or sitting for any amount of time is not a problem. They say that they are unable to bend. So a muscle called the quadratus lumborum is what helps with that. If there are any issues with the function of that muscle, it will cause difficulty in bending, specifically forward bending. So there are many such muscles, especially as we know in children who do dance, running, jumping, etc. The alignment of these muscles might be off. By correcting this muscle alignment, we have significantly reduced knee pain for many people in our practice. Many who came to us having been told they needed knee replacement surgery were able to get relief from their pain without any such surgery, simply by correcting their muscles. So in this person's case, according to their MRI, they had a significant disc bulge. Similarly, they had, I would say, double that issue with their muscles. Various muscles were affected due to abnormal movements as part of these dances. This usually happens when we perform certain movements suddenly without warming up the body. So it is the pain of many people. No matter how you look at it, even if you take an X-ray, the muscle problem won't be visible. It won't show up on an MRI either. Doctors might sometimes say it's just in your head, but the patient would be experiencing this pain quite significantly. So we can just, by touching and feeling, we can understand these muscle problems and such. So by correcting this muscle, sometimes those who haven't been able to lie straight or turn for years, we can easily get rid of all these pains. We will see you again with another episode. Thank you.